So our community care program is designed to respond to emergencies that might not require a full fire engine response.
They helped us get some new locks for the gas knobs on our stove, and some locks for different items in the kitchen, like the freezer, the fridge, knife drawer. Also told us some other things we could get.
Some of our patients here at the community care program have lost their spouse. So it's very important to us that we're able to help facilitate them with resources that are going to support their emotional needs, as well as connecting them with family members who may be out of the picture.
They came the day after they picked my husband up off the floor of the fire department, and they've been a godsend ever since.
It's also important that we're able to set them up with caregivers who are going to be able to take care of that single person now and provide them with the care that they're going to need so they can have the best quality of life possible. We also reach out to folks who have disabilities. We want to make sure that they can live their life to the fullest and set them up with the resources that they need so that they are able to thrive, not just survive.
There's been times when I can't get him up, or him and I together can't lift him up off the floor, so we call the fire department. Michelle and Chad's department was recommended to us about 2 weeks ago. I am so impressed when they came out, they went through the house of what we've done, what we could do, how to benefit. The idea is to keep Dad in the house for the rest of his life. And this is our goal, and I felt like he was pulling for that as well. Safety is a huge, huge factor in that.
Our team provides the patron assistance in helping navigate the complex medical system, providing the most cost-efficient and effective treatment for their particular problem.
Educating caregivers and educating the people that live in their homes. It's important.
This helps tie into our community risk reduction by reducing the number of repeat calls that we have to go on and really helping the patient find the solution that's going to meet their need.
So as a community care provider, we are able to respond to calls, but also go far beyond that. We have the opportunity to connect patients with the resources that they might be lacking in their life and get them connected and really focus on preventative medicine and longevity of care and getting them connected with resources or programs that may facilitate a better life for them.
We like to be pre-prepared, and we did everything we could, and it's nice to have a program that can step in and say, hey, we got some ideas for you if you want them, and we needed some ideas.
So a lot of our work that we're able to do happens because of the fire engines first respond via 911. So a lot of the calls they run on, if those crews identify a need that might be met other than the emergency room or maybe some follow-up after the emergency room visit, our community care response unit is then referred through a system that we have in place, and then they can go and follow up with that patient either at the hospital or when they return, or family members throughout that stay, and kind of come up with some sort of treatment plan or options that our community has to serve them in the best way possible. We've realized that an emergency room is not always the best option for every person that calls 911. So we're able to pair them and marry them up with resources in our community for long-term support, that they're able to flourish in their homes or get the support that they need to age well in place.